Thank you, Mario, for having me. Thank you guys for tuning in. So now this slide is quite humbling to me. All of these cases that you see on here are designed by me in-house. Now, some of these are composites that I did myself, and some of these are ceramics that I had transitioned over with my ceramist. In today's day and age, acquisition looks much different than just a scanner. We're talking about, CT scans. We're talking about face scans. We're talking about digital bite records. There's a lot now that goes into just the acquisition part of capturing the data. So we're going to kind of focus on how that works in our day-to-day. Now, the nice thing is about the face scanner is it kind of replaces the camera, okay, the photography, and in a more efficient way, because now instead of just seeing one view of my patient when I'm designing, I get all views of my patient when I'm designing. One of the biggest benefits we get when we do digital designing is a space for the face when we design. Now, here's a case where the photography failed me. Sometimes you can take the best facial photo you can possibly manage to take, and you can work out your design, which I did in Exocad, but the problem is I only have one view of Karen. And the biggest miss when I try to look at this from the side is I really don't know what this looks like from the side, from her profile view. So I just went off my jaw scan and the frontal view picture, and I tried in my temps after the surgeon extracted 8 and 9, and I turned Karen into Bucky Beaver. So this is a fail for me. At this point, I was like, okay, I need to bring in my face scan because I need to see how far out Karen's jaw actually sticks. Here we are auto-aligning the jaw scan to the face scan and the CT scan. The Ray software does all of this. So it'll auto-align the CT scan, your jaw scan, and your face scan all together. So everything now is auto-aligned. Once I get everything auto-aligned in the Ray Face software, I'm going to actually connect it into Exocad. So there is a bridge to Exocad. And once you click that, all of that will come into the software, Exocad software, aligned already. One of the biggest things that I think has kind of set Ray Face apart from the other face scanner that I have at my office is the ability to actually design inside the software. Now, anytime I want to position teeth anterior, posteriorly, more specifically when I want to bring them out, I'm always going to incorporate the face scan to see what this looks like from the profile view.